Today's topic is rabies vaccine. The main indication for rabies vaccine is dog bite or the dog scratch, then cat bite, cat scratch, then the monkey bite, then bat exposure. All these are the some of the indications for the rabies vaccine. If the dog has rabies, the dog will show some signs and symptoms like excessive drooling, then changes in voice or bark, then unsteadiness, disorientation, hallucination, barking or snapping at nothing, then sensitivity to light, then very aggressive behavior. They attack everybody. They attack everybody because their due to their aggressiveness, simply they bite those who come across with the dog. Okay, so these all are the signs. The rabies, uh, the dog that have rabies will exhibit. So when we are saying a dog bite, a group of dog attack will be most safer than the single dog attack, because single dog attack will have more chance for the rabies. Firstly, when you get a dog bite or dog scratch, what you have to do first? The first thing you have to do is washing the wound. So, firstly, you have to wash the wound with soap and water. So, the soap is an emulsifying agent, or they will when we are using the soap, they will wash out all the uh, virus. Okay, the running water that will help to run out the virus. So that is the peculiarity of the soap and water. It should be we have to wash for 15 minutes, and it should be in a running water. So after the washing the wound, we can use the antiseptic solutions like betadine or iodine solution or alcohol solutions. Anything can be applied on the wound. Then the next thing what we have to do is we have to immediately consult the doctor. During this consultation, what we are doing is we categorize the patient. So category 1, category 2 and category 3. Totally 3 categories are there. The first category exposure is touching or feeding animals, licks on intact skin. No prophylaxis is required. So if the liking or the touching or feeding animals on the intact skin, there will not be any problem. There is no vaccination is needed. For category 2, nibbling of uncovered skin, minor scratches, abrasions without bleeding, immediate vaccination is needed. That is IDRV, intradermal rabies vaccine is needed in this condition. For category 3, single or multiple transdermal bites or scratches, contamination of mucous membrane with saliva from likes on broken skin and exposure to bats, we need immediate vaccination and administration of rabies immunoglobulin. So that is regarding the category 1, category 2, category 3. Category 3 is most serious. Usually the category 1 there is no need of vaccination. For category 2, that is minor scratches, no bleeding, it need intradermal rabies vaccine. Then category 3 there will be transdermal bite and there will be bleeding. So in the category 3 we are giving intradermal rabies vaccine with the immunoglobulin. Next, regarding the rabies vaccination guide. So actually the rabies vaccination is divided in two forms, that is pre-exposure prophylaxis and the post-exposure prophylaxis. In pre-exposure prophylaxis means before the exposure of before the exposure, that means before the bite or before handling with the dog. So for example, the veterinary doctors, veterinary nurses, the dog handlers, then those who have pet dogs, all they comes under the pre-exposure category, so they can do the pre-exposure prophylaxis. So here in pre-exposure prophylaxis, there are three doses mainly. The first day we are giving first dose, seventh day we are giving second dose, then 21st or 28th day we are giving the third dose. So in pre-exposure prophylaxis, mainly three doses we are giving. uh, Post exposure prophylaxis, or after the exposure or after the bite, we are giving the IDRV or rabies vaccine in different way. The first thing, if the patient is unvaccinated, we have to give the 4 doses mainly. Especially in India, we are practicing in 4 doses. That is immediately when the patient is contact with the hospital, that time we are giving the first dose. So the that we are considering as a first dose. Then third day we are giving second dose. Then seventh day we are giving third dose. Then 14th day we are not giving. Instead of that, we are giving 28th day we are giving the fourth dose. So this is the uh, post exposure prophylaxis of intradermal rabies vaccine we are following in our state. Then regarding the patient is vaccinated. If the patient is vaccinated, the that patient need only 2 vaccine. That is when the patient is in contact with the hospital, that time we will do the immediate vaccination, that we are considering as first dose. Then third day we are giving the second dose. So this dose is a single dose we can give, and it is only in the upper arm. So if the patient is vaccinated, previously vaccinated, if the patient have re-exposure, that time we are giving only 2 doses. That is uh, the upper arm immediately at the time of reporting, and also in the third day single dose we are giving. But in case of unvaccinated cases, we are giving 4 doses, both the upper arm. Then in case of poor immune system, if the patient have malaria, if the patient have cancer, if the patient have multiple disorders, or if the patient have immunocompromised state or renal insufficiency, all these conditions, their immunity will be compromised. So that time we can give the intramuscular rabies vaccine. So intramuscular rabies vaccine, the dosage will be 5 doses we are giving. The immediately the we are giving the first dose, then third day second dose, seventh day third dose, then 14th day fourth dose, and 28th day fifth dose. So this is the format we are giving for intramuscular rabies vaccine. So in case of intramuscular rabies vaccine, we are giving 5 doses, and one vial we are using for one intramuscular injection. While giving intradermal rabies vaccine, we have to make sure that there is a wheel, there should be a wheel after the intradermal injection, and it should be appear like orange peel appearance, and it should be painful to the patient. It's an intradermal injection, it should be painful to the patient, and it should be taken both upper arm. And the main site we are used for intramuscular vaccine, that is deltoid muscles for adults and the children. In case of infant and small children, we can use the anterior lateral thigh. Usually we are not giving this rabies vaccine in gluteal region. and we are preferring the upper arm and deltoid muscles because of the lymphoid tissues are more in that area, so that will help for immunity. This is the image of rabies vaccine, and rabies vaccine in it can be given intradermally or the intramuscularly. Intramuscular we are using one vial. In for intradermal we are using 0.1 ml. The next thing is immunoglobulins. In immunoglobulins, there are two types of immunoglobulins: equine rabies immunoglobulins and human rabies immunoglobulins. Equine rabies immunoglobulin, or ERIG, it's a heterologous origin raised by hyperimmunization of horses. Human rabies immunoglobulins, they are free from side effects, and because of their longer life, it can be given in half the dose of equine anti-rabies serum. So the two types of immunoglobulins, equine rabies ERIG and human rabies, that is HRIG. This is the example for human rabies immunoglobulin. This is the example for ERIG. The dosage and administration of immunoglobulin. Human rabies immunoglobulin, we are giving 20 units per kilogram body weight. But the equine rabies immunoglobulin, that is ERIG, we are giving 40 units per kilogram body weight. And the equine rabies immunoglobulin ERIG, that is commonly available in our in medical colleges. Here the sensitivity test is needed because it is obtained from the horses. So the sensitivity test is essential for the ERIG, but human rabies immunoglobulin, it's also available, but it is too costly and it has no side effects. And the maximum dosage for HRIG is 2000 international unit, and for ERIG 4000 international unit, and all the immunoglobulin, that is based on the weight of the patient. As a conclusion, after the dog bite, if the patient is previously vaccinated, then there is only IDRV, intradermal rabies vaccine is needed. But in case of the first bite, or the patient is unvaccinated, that time we can give based on the category, we can give intradermal rabies vaccine and also the immunoglobulins. And firstly, what we have to do is we have to wash the wound, then we have to use the antiseptic solutions in order to uh, disinfect the area, and then we have to report the doctor, and the doctor will categorize the patient: category 1, category 2, category 3, category 2 IDRV is needed, then category 3 IDRB plus immunoglobulin is needed. Especially the bleeding, if the bleeding is occurs, we are preferring the intradermal rabies vaccine and immunoglobulins. And usually in this case, the wound will not be suture and it will be open, okay, most of the time. But sometimes the wound will be very large. That time, after taking the immunoglobulin only, we will suture, and we will not prefer suture because the immediate suturing is not preferred, because that suturing may cause the injury to the tissues and also the blood vessels, so that may cause the virus may enter into the another area and may rapidly progress the disease. So in order to avoid that, after taking the immunoglobulins, uh, we are giving the we are doing the suturing, okay. So mostly we are not preferred. And the tetanus prophylaxis is another important thing we are doing along with the rabies vaccine. So I hope you understood something regarding the rabies vaccine. Thank you so much.